Today, we're diving into one of the most talked about SMA treatments, Spinraza, and answering the most frequently asked questions to help you or your loved ones better understand what this therapy is, how it works, and what to expect. Let's break it down together. Spinraza, also known as nusinersen, was the first FDA-approved treatment for spinal muscular atrophy. It became available in December 2016, and its approval marked a major breakthrough in SMA care. For the first time, families had access to a medication that could actually modify the course of this condition. To understand how Spinraza works, we need to talk about the biology of SMA. The condition stems from a defective or missing SMN1 gene, which leads to low levels of a protein called SMN, survival motor neuron protein. This protein is essential for motor neuron health. Fortunately, humans have a backup gene called SMN2. However, it doesn't produce enough usable SMN protein on its own. Spinraza steps in by modifying how SMN2 is processed or spliced so it can make more full-length, functional SMN protein. This extra protein helps protect motor neurons, slow disease progression, and improve quality of life. Spinraza is approved for people of all ages and SMA types, from infants with type 1 to adults with later onset SMA. It's a broad-spectrum treatment, but every patient's case is unique, so eligibility also depends on individual health factors. One thing that makes Spinraza different from some other treatments is how it's given. It's not a pill or injection. Instead, Spinraza is delivered through a lumbar puncture, also known as a spinal tap, into the fluid around the spinal cord. The first 4 doses are given over 2 months as a loading phase, followed by a maintenance dose every 4 months. Understandably, this delivery method can be intimidating. But for many, the benefits outweigh the inconvenience. With proper care, the procedure can be safe and effective, even in people with spinal complications like scoliosis. Now, let's talk about what Spinraza actually does for the body. Many individuals see improved motor function, better head control, sitting ability, or arm and leg strength. For others, the most significant benefit is stability, stopping further decline. In the SMA community, that stability alone is a win. So, how long does it take to see results? That really varies. Some people notice improvements within weeks, while others see changes over months. The key is patience and realistic expectations. While not a cure, Spinraza can offer meaningful, lasting benefits. Of course, no treatment is without side effects. Some people experience headaches, back pain, nausea, or temporary discomfort after the lumbar puncture. There's also a risk of post-lumbar puncture syndrome or infection. While serious side effects are rare, they should always be discussed with your care team. Another major consideration is cost. Spinraza is expensive, with each dose costing over $100,000. But the good news is that most insurance providers, including Medicaid and Medicare, do cover it. Biogen, the company behind Spinraza, also offers financial assistance and support services to help patients navigate the insurance maze. Can Spinraza be combined with other SMA treatments? In general, it's not recommended to use it alongside other disease-modifying therapies like Zolgensma or Evrysdi. However, switching from one treatment to another may be possible, depending on individual response and physician guidance. One question we hear a lot: what if someone has a complex spine or has had spinal fusion surgery? Can they still get Spinraza? The answer is yes, in many cases. Image-guided lumbar punctures or even surgical access ports can help make administration possible, but it requires a specialized medical team. Once on Spinraza, patients will undergo periodic assessments to monitor strength, breathing, and blood work. These routine checkups help ensure the treatment remains safe and effective. So, is Spinraza safe long-term? Current data says yes. Many people have been on Spinraza for several years with positive results. Long-term studies are ongoing, but the safety profile remains encouraging. Spinraza gave the SMA community something they never had before: an option. A chance to intervene. A shot at slowing progression and holding on to strength for as long as possible. If you're considering Spinraza or are already on it, stay connected with your care team, stay informed, and don't hesitate to advocate for yourself. Every journey with SMA is unique, but no one walks it alone. Thank you for tuning into today's FAQ. If this video helped you, consider liking, subscribing, or sharing it with someone else in the SMA community. Your voice matters, and your awareness makes a difference. Until next time, stay strong, stay inspired, and keep spreading hope.